Hello, good morning. Today on Let Your Food Be Your Medicine, we are looking at fibroid. That's non-cancerous growth that some women develop at a point in time in their lives, and sometimes it becomes a problem for them. Sometimes some women feel like they can't get pregnant because of it, and some have some pains alongside with it. So that is what we are going to talk about today. What are the causes, who can get it, what is the percentage of people that can have it, and then what are the treatment options that God has given to us today. So today we have discovered already that about 20 to 70% of women have this fibroid, and then this thing is owing to no other reason other than hormonal imbalance. Now that hormonal imbalance is as a result of estrogen and progesterone, which is responsible for the preparation of the body for the menstrual cycle, which leads to pregnancy. Now, when there is an imbalance between the progesterone and then the estrogen, a woman may develop, sometimes, not all, may begin to develop states like fibroid and other problems. But this fibroid, it is not cancer, but it is not non-cancerous growth actually. So should we worry about it? Sometimes yes, sometimes no. Now if the fibroid is growing so big, maybe sometimes they go to the hospital, they will tell you that you have multiple fibroid. So sometimes you feel like I have a big problem. Now it depends on getting pregnant with fibroid, depends on the location and the size of the fibroid. So sometimes I always advise that you get rid of it or shrink it, or try to shrink it before you get pregnant. So what are the signs, what are the symptoms? How do you know if you're having fibroid, and who can get this? We know that women who are in their 30s or 40s, or even the ones that are experiencing menopause, most of them have fibroid. And then some are not even 30 and some are not 40. If you're black and you're a young woman that is black is at a very high risk. You're more prone to have fibroid at a very younger age than a white person. So a white person may get fibroid at 30 or 40, while a black person will get fibroid. That is why you see somebody that is under 30 having fibroid. So it is not like maybe the person is not reproductive. Fibroid actually happens as when a woman is at her reproductive age. So now, what are the treatment options? Even before the treatment options, what are other causes that you can see? Sometimes a woman will be having sexual intercourse with her spouse, and then she will be having some discomfort, maybe vaginal dryness, some little bleeding after sexual or during the sexual intercourse. Some persons, I've talked about vaginal dryness before, so if you don't know about this, please, you can check my video on vaginal dryness and how to treat it. I also said it is as a result of hormonal imbalance. So in this video, I will also give us a natural remedy that we can use to balance our hormones. So now, what are other things that you can see? Some person will be having pelvic pain, some will be having vaginal bleeding. Now some will be having so much discomfort. Have you seen a woman maybe after marriage or even before she's married? Maybe some people will be seeing her, especially the ones that just got married. You will see the person, they will be telling you congratulations, because the person's stomach is so big, and then you are not pregnant, and then you keep trying to explain to people, I'm not pregnant too, I'm not pregnant, I'm still hoping, and then the people don't understand. They feel like maybe you are lying. Sometimes it's as a result of the fibroid, which you don't know, because sometimes it doesn't come with pain or discomfort or anything. And some women, maybe before they get married, they don't know that they have the fibroid, because some are practicing celibate. If you're a celibate, you may not know, depending on the size of the fibroid. So you may not know if you're having fibroid or not. So what do you do when you find out that, how do you know if you have this? The best way is to go to a lab, and then they will carry out some tests for you, and then you'll be informed if you have or if you don't have. If you don't have, congratulations. But if you have, these are the treatment options. First of all, I always try to start my treatment option with you avoiding with exercise. First is exercise. Second of all is, if you're taking sugar, please, you need to stop it. The mince pie, the egg roll, the snacks that you take that contains sugar, you have to stop it if you must avoid having fibroid, or if you must treat yourself of fibroid. You have to stop that completely. Now, another option is this: you must eat fruits and vegetables every day, not just once a while. Make sure that as you're eating your food, there is a plate every day for fruits and vegetables every day. So you make sure that you increase your intake of fruits and vegetables. This is very, very important if you must get healed. So you eat more of natural things. Sometimes I always say this in all of my videos: reduce, if you are having any particular problem, reduce the amount cooked food that you eat non-cooked meal. Just the way it's coming from the farm, you are eating it directly. Now, another treatment option is one which I have given in one of my videos. I talked about Jiximol. You can actually get Jiximol. It helps a lot to shrink fibroid. Now, another one is this it works so well also. If you can't get Jiximol, if you need Jiximol, you can actually indicate in the comment section that you are interested in getting one. I will actually send you somebody who will get it to you. Depending on your location, wherever you are, is not a problem. Now, another treatment option that I have, this is it. You get what is it called? Organic apple cider vinegar. Organic apple cider vinegar. When you get the organic one, there are some particles under it. That means it is the original one. So when you get it, shake it very well. Depending on the size of the fibroid, please. If it is so small, maybe it is not multiple fibroids, just something very small, you can be taking 1 spoon. That's 1 spoon of the apple cider vinegar. Add lemon to it. So this is the lemon I'm talking about. Exactly this one, get it. It's sometimes scarce to get, but if you check in some supermarkets that sells fruits and vegetables, they always have this. It's kind of expensive sometimes, but get this. Cut this into 2. Depending on the size of the fibroid, you can actually cut this into 2. Use half in the morning and half in the evening. But if it is very, very big, you can actually use this. It doesn't harm. Then when you get this, you can dilute it a little with water. Mix it together with the apple cider vinegar. Take it morning and evening. It disappears. In fact, when you go to the hospital, make sure that before you start taking this, for you to know if it is working, make sure that before you start taking this, that you have gone to the lab and they have confirmed that you have fibroid. Then you go home and start taking this. Then return again back to the lab and take another test. You will see the confirmation from your doctor. I'm not the one that will give you the confirmation. It is your doctor who will give you the confirmation. So that is a treatment option. Now, for somebody may ask, what if I'm trying to get pregnant? Can I take this apple cider vinegar? Now, it depends on the size of the fibroid. It depends on the size of the fibroid. Some women, you have a very big fibroid, and then you are trying to conceive. Your doctor may tell you that you should go ahead and conceive, but I need to borrow you this knowledge that while you are pregnant, whatever fits the baby, for whatever fits the fetus inside your womb, is also feeding the fibroid. So as your baby is growing, the fibroid is also growing. Now you may end up having serious pains. Sometimes you may end up having contraction, maybe 5 months, 4 months to when you are going to deliver. You start having serious pain, serious discomfort, that they may tell you that, should we evacuate, should we remove the baby, what do you want us to do? So it is always good that you get yourself treated before you try to get pregnant, because as the hormones that is feeding the baby is feeding the baby, also feeding the fibroid. Both of them are growing. Now you may hear sometimes they will tell you that sometimes you should get pregnant, that when you get pregnant the baby may shrink, the size of the baby may shrink the fibroid inside your womb. Sometimes it works like that, sometimes it doesn't work, and that is why I always recommend that you treat yourself before you. But if you're in a hurry that you really need to get pregnant, then it depending on what you want, I will only tell you this is it, and then I will not tell you not. But if you're pregnant already, please do not take the apple cider vinegar. I beg you, do not take the apple cider vinegar with the lemon, please, because it may not work well for you. Please, if you are not pregnant, you can take it to reduce to shrink the fibroid before getting pregnant. But if you're pregnant already, please don't take. Somebody will ask, what if my doctor has already told me that I should come for surgery in order to get rid of the fibroid? Let me tell you this. After the surgery, the fibroid has a very big tendency of growing again. The fibroid may still grow again, and that is why I always say this: whether it is very big, no matter the size of the fibroid, no matter it is already multiple fibroid, in fact they said it's everywhere in your womb, my dear, please do not go for that surgery. Do not go for the surgery, because that does not recommend or confirm that you'll be fine after everything. So please avoid surgery. Avoid whatever you know that will lead you into having fibroid. One, sugar, no sugar, please. And then make sure that you take fruits and vegetables. Then take apple cider vinegar with lemon together. Add a little amount of water to it. Then if you don't want that, you can actually take Jiximol. It's very, very important. Now, if you want to balance your hormone, I said I will give us what you use in the end of this video. Now, to balance your hormone, you can take coconut oil, virgin coconut oil, cold pressed. You can take that every day, 2 spoons morning, 2 spoons evening. It's quite expensive, but because of you need to get well, please take it. Then if you have pear, this our English pear, the one we have that is very big one, you can actually be taking that. Maybe you want to eat something like all this wheat bread and the rest of them. Make sure that what you are eating contains enough fiber. Yes, fiber rich food, you eat that. So if you must take bread, let it be maybe wheat bread or anything good, natural good. So you can take your wheat bread with your with your avocado pear. Yes, avocado pear. Mix that together and take it every day. This helps a lot. In fact, you will be the one that will come back to thank me. I hope this video helps you. As you are here getting this message and this information, please try to share with other people so that they can get the message and share and pass it on. God bless you.